What's going on, everybody? This is CJ Hunter, aka CJ the Exec, and welcome to the Wellness Corner, where we chop game up about how we can incorporate health and wellness into our everyday lives. Now, before we move forward, I want y'all to go ahead, hit that like button, smash that subscribe button, and gently, just gently, go ahead and strike that notification bell so that you can, get updates on the new content and videos as they come out on the channel. I really appreciate your support. So in today's video, I'd like to discuss the open enrollment period, specifically for getting medical insurance and, through the marketplace, that was set up through the Affordable Healthcare Act. I think that it's very important to discuss that because the open enrollment period started on November 1st and is quickly coming to an end on December 15th. So, I wanted to do a video to kind of talk about the importance of that process before, the open enrollment period ends. In a previous video on the channel, I talked about, how I was going to be doing a bit of a pivot for the CJ Hunter YouTube channel. You know, at first I was talking a lot about how I go through things being a black man with lupus nephritis and just all of the things that I go through with that, and I've also started to open up about my process of going through dialysis at the moment. But I kind of wanted to make a pivot from that and expand what this channel is all about. This channel is about more than just being a black man with lupus and one specific disease. I wanted to create a community by which people that have all kinds of health and wellness afflictions can come together and use this as a safe place to, talk about the things that they're going through, be a resource to one another and really just create that community. I especially wanted to do this, for my people, for black folks, man. Now I'm not saying that everybody don't go through stuff, and I'm more than willing to chop game up with anybody that's going through things because, after all, illness don't know no color. But specifically for me, if you know me, if you know the CJ Hunter brand and who I am as a person and how I've always been, the love and attention that I pay to my people in particular is something that I've always, held near and dear to my heart. And the fact of the matter is, brothers and sisters, is that, man, like, we are going through so many different wars and crises on so many different fronts. And for me, one of the biggest things, especially because I go through it on a daily basis and I see it, is our health and wellness. You know, Black folk, we are, in a danger zone when it comes to our health and wellness. I mean, man, we lead in heart disease, we lead in obesity, diabetes, all kinds of things. And I know that, based on so many different environmental factors that are steeped in begin at its root with the system of racism and white supremacy, there's still, even though we know the cause and we know that there may be food deserts and restaurants that don't serve us and not having enough grocery stores that sell, fresh, good produce and all of those things, you know, that's still something that we got to come together and really work together to remedy on our own, because ain't nobody coming to save us. And the bottom line is that we gotta get healthy. We gotta be well, especially to my brothers. Specifically to my black men. Man, one of the things that broke my heart upon getting out of the hospital at the beginning of October and having to start dialysis at a dialysis clinic was the fact that I walked in with this woe is me type of attitude. I ain't gonna lie to you. I'm not gonna lie to you. Like, I was seriously thinking, like, man, you know, I'm probably finna be the youngest person in here. You know, like, what have I done? Yada, yada, yada. And what really, really broke my heart was to see not only how many people that was in this place that looked like me, but how many black men ranging from younger than me. Like, there's a brother that goes to, the dialysis center that I go to that is 28 years old, younger than me, all the way up to elders that's, in their 60s and 70s. And man, it's just like, and what's crazy, brothers, is that for the most part, we represent a small, portion of that population, which means that we suffer even more. Just like with black men with lupus, we suffer even more because there's really no real medical protocol, because we represent an enigma, a medical enigma of sorts. We like fucking unicorns, and it just that broke my heart. And so the goal of my channel at this point is to, have discussions and provide resources and information, and really just chop game with y'all about just different topics that can help us, and hell, that can help me. Because don't get it fucked up. Please don't get it twisted. Like, when I'm talking to y'all, I'm talking to myself too. I have days and times where I'm not doing right. And I need to be holding myself more accountable. So I'm not preaching, I'm just expressing my love for my people, and expressing love for just folks in general, just to be healthier. Because one thing about it, fellas, and let me backtrack. One thing about it, period, whether you a man or a woman, however you identify, is that we have responsibilities, we have goals, we have dreams, we have people that we want to provide for, we want to take care of. And none of that stuff is possible if we ain't taking care of ourselves first and foremost from a health and wellness standpoint. The highest form of human behavior, in my opinion, is self-preservation. My mama used to tell me that all the time. Like, self-preservation come first, Christopher. Period. And if you ain't no good to yourself, then you certainly can't be no good to nobody else. And think about it, y'all. Think about it. We go through the most health disparities. We go through the most health disparities, y'all. From diabetes to heart disease to everything. Like, we go through the most health disparities. And me doing this open enrollment video is important to me, because the very first step, in my opinion, you can do all of the homeopathic medicine that you want to do. You can take all of the sea moss gel. You can, do all of the things. You can do all of the things, man. Take all of the pills, eat all of the fruits and the vegetables and things of that nature. But even people that eat in those ways have a possibility of getting sick. And there is no better way to help yourself than to be insured, and to try your best to get insured. And, going through the Affordable Health Care Act and the marketplace to go about doing that is important. Health insurance is the first step. Just getting health insurance, and then choosing a doctor that works for you, that understands your medical history, that can provide you with service, understanding who you are as a person, your cultural background, and just being able to connect with you on that way is important for making sure that your care plan, whether you're perfectly healthy or whether you're going through something, like is fit and tailored towards you. All right, so there are 6 ways, according to the healthcare.gov website, that y'all can go about doing this. Now, I've included some alternative ways because understand this. I know that based on lack of resources and based on just not really fully understanding how to go through this process, man, so many people will need folks to guide them through this. So I'm not finna give y'all no suggestions that's just all about getting online and doing this and doing that because on the cool, I really hope that you will not only take this information for yourself and help yourself, but we need to also take into consideration helping our elders through this process. Because we have elders out here who are stuck only with Medicare and only with Medicaid and these government forms of health insurance that if we being honest, they don't really serve our elders because you could get Medicare, you could have Medicare as your insurance, but then you got to get a Medicare Part D plan for your, and all these other plans for your prescriptions, and all in all, you got elders that's on Social Security disability, veterans retirement, retirement, whatever the case may be, and these government plans got them is only paying for 80% of their fucking their health care. And so they got to come out of pocket and have these high ass copays and all of this stuff for insurance in a country where they could easily be paying for our elders full insurance so that they don't have to spend, money out of their Social Security checks and their Social Security disability checks and have to decide between motherfucking, paying a light bill, eating, or getting their prescription medication, And so I hope you take this information and help our elders as well. Because this insurance through the marketplace, especially if they qualify, can act as a supplemental insurance so that they can go to the doctor, get their prescriptions, and do all of these things without having to pay out of pocket and have a little bit less stress in their life. So I'm gonna be taking, the stuff from my notes. So bear with me. I don't want to be reading to y'all, but I got a lot of stuff written down that can help. So number one, find and contact an agent or broker or a sister. Like what this is you would be going to the healthcare.gov site and literally like entering in your zip code for a list of local people and organization. And what this does is it aligns you with people within your zip code, and you can choose these centers and people and brokers who are close proximity to you, and gain assistance either in person or via the phone. Number two, you can have a broker or agent actually reach out to you, right? Like if you enter your information into a marketplace, a marketplace registered agent's site, they will get in contact with you directly. Like that option, along with another option that I'll be talking about later, is exactly what I did, and I'd say probably within an hour of being on the phone, I not only had my insurance, but I had a dental plan, a vision plan. I had a supplemental like accidental like in like insurance type of deal where if something were to happen in an emergency that wasn't covered by my insurance because I was paying into this, everything would be covered, right? Like and I did all of that over the phone. Number three, you can use a certified partner's website. There's all kind. You just type in marketplace insurance, and there are tons of partner websites that are specifically contracted out through the federal government to help people sign up for insurance, even without you having to go to the healthcare.gov website. So that right there is really, really dope. Really, really dope. Number four, and this is the option that I used like in particular. You can go to the healthcare.gov site and sign up there, right? Like if you're new, to the healthcare.gov site, which I'm assuming that, any of you that are watching this who don't have this information will be new. All you have to do is create an account. If you got an email address and all of the other stuff, you put your email address, your zip code, all of that stuff, and you could get started on your application via the healthcare.gov site right then and there. Now, number 5 and number 6 is for my old school folks. Now, I get it. And, my lady gets on me all the time for talking about this and saying this because, it's a thing. But for me, for the most part, man, I don't like technology not because it's not useful, but technology will always find a way to let you down. Like always. Like something will glitch, something won't save, you'll have to refresh a page, start all over. Like it's all kind of stuff that could go on with that. But, these last two options give you the ability to bypass all of that and do it the old school way. Number 5, contact the marketplace call center and enroll via the phone. You see, what's that? 2, 4, and 5. That's that's easy. You know what I'm saying? Like all you got to do is just have somebody call you and set everything up in that way. And then number 6, you can fill out and mail in your paper application. And when you mail it in, you'll get answers and be contacted about your eligibility via the mail within 2 weeks. Now, of course, in order to get access to the application, you would need to first of all have access to a computer and a printer and be able to print out the PDF form of the application via your printer, and then the rest is just doing what you do. And so all of that, you know, makes everything easier, cohesive. A lot of people feel comfortable, more comfortable with doing that. So it's just a win-win. It's a win-win. Now, for my folks that visually need to see some shit, right? Because I know y'all, man. I'm a visual learner myself, so you need to see, the process of going through the steps and all of that stuff. Don't worry, I'm currently putting together a video where I'm doing a tutorial on how to go through the healthcare.gov site. My brother Cobb, DJ Cobb Alexander, shout out to Cobb of the Build, and from my ox to yours. We're producing a tutorial video so that I can literally be on the laptop and show y'all what the steps are and how to go about doing this thing, so that when you take the video, that video, you can literally sit it next to your computer, your laptop, and go step by step with what I've done, and and get yourself insured, man. So that's all, y'all. Like, I appreciate y'all tuning in. I really, again, thank you for watching. Like the video, comment, share this video, subscribe. If you have tips that I did not cover, put them things in the comment, man. If you're watching this on YouTube, engage, man, engage. I love to have conversations with folks in the comment section because I don't know it all. I'm just passing on information that I feel like can help people, and so you know let me know what y'all think in the comments. Also, please let me know what other pieces of content, what topics you would like to see me cover and engage in. Because that helps me create things that y'all actually want to see than just assuming. Last thing, man, it is November. I'm trying to, reach a certain number of subscribers, y'all. I would really, really like to get to 50 subscribers by the end of December, and I would really love for y'all to help me. Can y'all please help me get there, man? Because I want to grow this community. I'm dead ass serious. Like I'm dead ass serious about that, and I would just really appreciate y'all engaging and joining the family. Sitting down at the wellness corner with me and engaging in other content that I'm going to be bringing for y'all. I appreciate y'all for watching. This has been the Wellness Corner. I am CJ Hunter, aka CJ the Exec, and I'll see y'all soon. Deuces.